Knock, knock, knock. Hi, I'm Cassandra, nursing student, and today I'm looking at the physician's orders, and he ordered a respiratory assessment. Can I get you to clarify your last name and date of birth, please?
Black 8/25/1992.
And do you have any allergies while I look at the wristband?
Nope.
Okay, I will close my door for privacy, wash my hands, and put on my gloves. I brought all my equipment with me, and basically we're going to look at your respirations and listen to your lungs. Are you comfortable where you're sitting?
Yep.
Okay. First, I'm going to ask you 3 questions. Do any history of smoking?
Nope.
Any history of pneumonia?
Nope.
Any history of COPD?
Nope.
Okay, and while I was doing that, I was also looking at his respiratory rate. I count for 30 seconds in time for 2, unless it was irregular that I would count for a whole minute. But his respiratory rate is symmetrical, even rise and fall of the chest, and it doesn't look like he's having difficulty breathing, and symmetrical depth and rate too. Now I'm going to look at the AP lateral ratio, and that's 1 to 2. And now I'm going to have you stand up, please. And I'm looking at his spine. I'm looking at lordosis, which is the curve in the spine, kyphosis, which is the hunchback in the spine, and scoliosis, which is the S shape in the spine. And there is none present, so that is good. Now I'm going to do, since he's standing up, I'm just going to keep moving on. I'm doing the excursions, so I'm going to put a W here, and I'm going to have you take a deep breath in and breathe out. Awesome. And my hands did move symmetrical when he took a deep breath in and out, which is good. Now we're going to test the tactile firmotus, which is, I'm going to use like the bony prominences of my hands here, and I'm going to have him say 99 while I feel for vibrations down his back. Okay?
99.
Okay?
99.
Okay?
99.
Okay.
99.
Awesome. And I felt vibrations in every spot. I'm going to have you sit back down, please. While I did this, I was also feeling his skin, and his skin is warm. It's not moist or damp or hot. And his skin doesn't have any lesions or discolorations or any masses that I can see. And the color is consistent throughout his whole body. Now I'm going to palpate his trachea. And it's midline. There's no masses I can feel. It doesn't, no discomfort at all. Now I'm palpating his chest and his anterior thorax. Okay. There is no masses, tenderness, or lesions and no abnormal findings, which is good. Now I'm going to have him stand up again, and I'm going to listen to his posterior. So I'm going to listen to his back, and we're going to listen to 18 spots. I'm going to have him take a deep breath in and out on 18 spots here, and we're going to work our way down. And we're basically listening to the lungs and listening for airflow. Okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. All right, and that is good. His lungs were clear. There's no crackles or any abnormal findings there. Now I'm going to come to the front here. I'm going to listen to the anterior side of his chest, and we're listening to 10 points of the chest. And I'm going to have you take a deep breath in each time too. 1, 2, 3, 4, 6, 7, 8, 9. Good. And the lungs were clear on this side also. There was any diminished lung sounds or anything. There's no crackles or abnormal findings there. I'm gonna have you take a seat, please. And is there anything else I can do for you today? I have time.
No.
Okay, and I would document my findings and report to the doctor.